Hi, everybody wants to look young, and part of the fountain of youth is to have beautiful, young-looking skin, especially on your face. And today we have one of the world's leading experts to tell us how to look young and stay young and keep our skin young and healthy. Today we have a great guest, Dr. Nathan Newman. Dr. Newman is a board certified dermatologist and cosmetic surgeon. He practices in Beverly Hills, California, which is the world's capital for people who want to look young and stay young. And in Beverly Hills, he treats many celebrities and keeps them looking really good. He's an expert in stem cell treatment of skin for over 25 years now, and he's the founder of STEM Natural Intelligence, which we'll talk about in detail. He's also now an author, which is very important because he has a book that will explain to the public how they can keep their young skin healthy and vibrant. So, Dr. Newman, thanks very much for taking the time to join us today. We really appreciate it.
Thank you, Doctor. It's a pleasure to be here. It's really an honor to be part of this because I think educating the public is a paramount for us, and the more we educate the public, the better they can make better choices for themselves.
Right, absolutely. This is all about education. So, can you share a bit about your background in dermatology and dermatologic cosmetic surgery? How did you get interested in that?
Well, I always wanted to become a doctor. My whole family were all doctors. My
Oh,
father, my grandfather, my brother. I mean, it's been
wow.
like the DNA, doctor DNA gene, says.
You've got that
But
doctor DNA in you. That's great.
uh, so I love to go to my dad's office and look at, what he does. And he was a doing a lot of general medicine and surgeries. Um, and I grew up knowing that I wanted to do things that were a little bit more aesthetic. So I went to dermatology. In dermatology, we were doing a lot of different treatments besides doing the regular acne and skincare. We were also doing a lot of cosmetic things, including hair transplants and fat grafting, and we were seeing a lot of challenges with the techniques that were available at the time. Because I enjoyed those challenges, I went to do a fellowship in cosmetic surgery. In cosmetic surgery, I went and saw many different experts from different backgrounds and saw their techniques and saw what was happening. And Dr. Aramia, who was my sort of mentor at the time, I loved how he thought about keeping everything pure and clean and, you know, in a closed system. In the old days, fat was taken out, put in a sieve, washed, scooped up with a spoon, put it in a syringe and injected back. That didn't do so good. So the idea was, keep everything within the syringe, wash it, keep everything there, don't expose it to the air, and do micro injections instead of macro injections. So instead of just pushing everything into one area and trying to massage it in, actually put it exactly where you want it in micro doses and then build up from there.
Hmm.
So that really changed my perception of how to do things. And when we were doing all these changes, there was a paper that came out that said the fat contains the most amount of stem cells of any tissue in the body.
Hmm.
And when you
Interesting.
take it out, it layers out, and this is the fat layer. And that was like the aha moment for me. The light bulb went off, and I said, Eureka, that's why it's working, because we're keeping the stem cells with this procedure, and the other procedure, we're just getting rid of it. So I said, if I'm getting so much better results with this procedure, why don't I just concentrate those stem cells and see what happens? And I started developing what I call the stem cell lift, which is sort of lifting off the stem cells that are found in between the fat cells, concentrating them, and then injecting that back with or without the fat cells to do a whole slew of things, including cosmetic surgery. And that's really how I got into stem cells.
That's fascinating. I didn't know that fat contains so many stem cells. That's good to know. Very important. Now, tell us what stem cells are for the audience. I'm sure they've heard the word stem cells or the phrase many times now in recent years. Can you explain what stem cells are and what role do they have in skin health and anti-aging, basically?
Stem cells are actually universal cells found in all human beings and actually plants also have stem cells. Anything that needs to grow, anything that needs to renew, anything that needs to heal needs stem cells because those are, in Spanish, they call them mother cells. They're the cells that become other kind of cells. They're the cells that can reproduce themselves so they can maintain themselves throughout your life, but they're the ones that become your hair, your nails, your skin, the turnover that we see, the new cells that come out is the stem cells converting into those kind of cells. Until recently, we didn't actually know that every part of our body did that. We thought like you were born with the same certain amount of neurons in your brain, and whatever it was, that's what it was. The same thing with the fat. And we know that's not true. Everything is very, very renewable. It's just different rates. So every part of you within the last 10 years has been renewed. You are not the same person you were 10 years ago. And that's because those stem cells are renewing you. So as long as we're alive and we're healthy and we're good, those stem cells are keeping you that way.
Interesting. So those are the basic cells that create all other cells, depending on what part of the body they're in. And how do you approach stem cell skincare, and how's it different from other anti-aging treatments that are on the market? I'm seeing a lot of TV commercials now and commercials online for various topical creams and other agents that people should apply to their skin. The Wall Street Journal just a few days ago had a huge article about skincare products for men, and they reviewed, I think, like 40 or 50 different skin creams. So, how is stem cell skincare different than topical agents applied to the skin, especially in the facial area?
It's a great question. I mean, we are looking, stem cells are revolutionizing entire the entirety of medicine. Like we had
Right.
antibiotics, then we have anesthesia, then we had, lasers. Now we have stem cells. So stem cells are being used in the clinic. The way I use it, I use your own stem cells from your fat, but you can get stem cells from different cord blood or from placenta. A lot of people use which are not your own. And we can inject those cells to cause a change in your body, to heal something, to renew something. They're regenerating, right? So they're renewing whatever we're trying to do, either be it for cosmetic or for wound healing. And what happens is when I was doing my treatments of the patients, when you're doing a cellular treatment, it takes months for something to happen and to heal and to get there. And with stem cells, I was seeing changes within weeks, sometimes within days. And you're like, this is not something the cells are doing. This is something the cells are producing that's causing this change. So I saw that and I opened up my lab and I started to research stem cells. And we learned that the stem cells have a language that they talk to each other and they talk to the other cells. That language is what is doing all these changes, even when we're injecting it. So a lot of new technology had to be developed to create all this. And we were using it topically. So we were taking the cells, growing them, getting the language, and trying to figure out what they do. And what we found out is that these cells change their language based on their environment. So the environment that they're growing in makes a difference in what they're saying. Just like we are going to change, right? If I'm talking to you, I can use my words, I can use my hand, I can do other things. And the cells are doing the same thing. And what happens is with these cells, um, we can create specific solutions that now we can apply either on the skin or we can inject it and get a non-cellular effect. So we don't need the cells themselves. We just need now what the cell language is. And what happened was regulatory wise, you can't use human-based products in most of the world. So we had to come up with things that were not human-based, and we went to the plant world, and there is a vast amount of information on Ayurvedic medicine, where we know that certain plants are used for medicinal purposes and they have a lot of science behind them. So we knew that stem cells existed in plants, and we just would need to know, do those cells speak the same language as human cells?
Right.
And lo and behold, we found out they speak the same language. They have a different dialect. They don't say the same words the same way, but when it when it's put in context, the cells understand one another. And it was amazing because now we were able to not just use one kind of cell or two kinds of cell. We had thousands of kinds of cells from all this data we had to create different products. And we actually had to develop a whole platform technology to do this process where we go from the cell to the product. We had to develop the whole technology, and that technology is now patented by us, where we can take any cell, put it through this mentoring process where the environment that we want them, so that they can give us the language that we want. That language, we call it consortia factors, because it's the consortium, is the entirety of the language. To your point, how is it different from the other products that we were using is I in the old ways, we were using one peptide, or we were using one vitamin, or we were using a retinol. So if you're using a word like retinol or vitamin C or hyaluronic acid, those signals are just saying one thing to the cells. So they're not really communicating with the cells, they're communicating at the cell. So the cells will respond to a certain point, and then that's it. But here we have the whole set of directions that we're giving to the cell. And they don't have to be made into certain carriers because the cells understand what this is, and the carriers are already made within it. So they get to go into where they want to go without having to have all sorts of alterations or all sorts of artificial things to put on them. So these cells now are regenerative ideas versus an anti-aging idea. So before we were
Hmm.
trying to fight something, now we're not trying to fight something. We're trying to work with your body to heal it, to regenerate it, to rejuvenate it. Completely different concept. So this idea now is universal. Now, if you're young, if you're old, if you're a man, if you're a woman, if your skin color is whatever it is, the universal language is universal. It works on everybody. And the
Yeah.
body knows what to take from it and how to utilize it to restore balance and health to the skin.
Hmm. So specifically, where do your stem cells come from? Where do you derive them from?
So in the clinic, I use your own stem cells. But in the products that we've created, this STEM Natural Intelligence line that we created is all based on plant stem cell technology. So we use the plants with all the data and science that we have. We've tested them. We know how to grow them to give us the specific language. So if we want to use a product that says to reduce inflammation, we have that. If we want to give you a product that says rejuvenate the skin and tighten it and make it lighter and brighter and more youthful, that we have as well. In fact, the serum that we have that does that, we call it the regenerative serum because it's regenerating.
Okay. Now, the stem cells you get from the patient, those are taken from a different part of their body. Where do you get those cells?
So the benefit of doing the stem cells in the clinic is that we can use cells from any part of the body. We've actually studied what the differences are if you take it from the stomach versus the flank versus the thigh. And at the end of the day, you're going to have the same good results.
So
The differences,
you're taking fat basically from different parts of the body, getting the stem cells. Now, do you inject those under the skin in the face, or are they applied topically on the skin?
no, in the clinic, we're doing surgery. So we're doing uh, so let's say you want to come and do a facelift. In the old days, I was trained to cut, pull, and so that's a two-dimensional heightening. It's not a lifting, is a, you're pulling. So with our aging is a three-dimensional change. You're losing volume. It's like when you have a grape and it becomes a raisin. It's a
Mm,
three-dimensional change. I
right.
can take that raisin and pull it. I'm not getting that raisin back. I'm just, getting the wrinkles out. But if you're gonna want that raisin back, you gotta inject the stem cells in it, and then it'll improve the skin back, it'll bring the
I see.
volume back, and will give you the great back. That's really the change in what we've done. We've taken this idea of regeneration and applied it so that we can now do a facelift without scars, without going under the knife, without having to change your face. You just you looking younger like you were, without having to go under general anesthesia, which has its own risks.
Yes.
And and the results last longer and better because it's regenerating. So you're resetting the time from the aging that we're going to do. With facelifts, we just look younger, but we don't actually make you younger. We don't bring back collagen. We don't make new
Right.
blood vessels. Here we're actually turning back clock. We're turning back the clock and we're saying, you're going to go back 5 to 10 years and we're going to age from now.
Wow.
In 10 years, you look even better than you do today.
I'm calling to make an appointment after this program.
I love it. My honor.
So that's called your non-surgical stem cell lift?
Right. So that's the stem cell lift is when we take the fat from the body, concentrate the cells and inject it back and restore the face.
Wow.
That is a different procedure than if you were to buy the serum and the products that we make from the plants where you just apply it just like any other serum that you would do on the skin.
Topically. I see.
Yeah.
Now, what kind of results can patients expect and how long does it take? You said it works quicker than you even anticipated initially. So how long is that?
So when we inject, you're going to get swelling. Anytime you do anything to the skin, you're going to get swelling. So
Right.
swelling and bruising is about 2 weeks. And then after that, you start to see the improvement in the skin. In about 6 weeks, the cells have produced enough collagen and enough changes in the skin that you start to notice the quality of the skin is improved and is noticeably changing. And at 3 months, the change that we have, the volume, the skin improvement is there permanently. And then from there, you continue to improve for a year. And then after that is just the aging process. So it's
Right.
very different than when we did the cutting, because the cutting, you did it the whole thing that you have to now wait a couple of weeks to take out the stitches. Then you had to wait for the scars to heal. And it was a much longer healing time. Here, people can actually do it and they go out. I mean, they're not bound in their house. There's no
Right.
bandages.
Now, how long do the results last and do treatments need to be repeated?
So the results are permanent. So whatever you have at 3 months, that's grafted into the tissues. That's part of you. It will age with you. It will change with you. It is looks natural and never looks out of place. Unlike fillers, sometimes if you put too much, it looks out of place. Or if
Right.
we do a facelift and we're changing the way the skin sits or the muscles sit, when you smile, sometimes it looks odd and not the way it used to look. With this, it doesn't do that. So the changes are natural and they last you permanently. It's a permanent change. How
Right.
well you age is a different question. That's genetic, lifestyle, how well you are. But an average 5 to 10 years before you start to see some wrinkles or some changes in your skin. And unlike doing a facelift where we have a lot of scarring and a lot of problems to go back doing a secondary or a third surgery, which is very dangerous to do those, here we don't have any of that. In fact, you have more resources now, so that if we do it again, you actually get better results because the resources are better than you were before. You have more blood flow, you have more infrastructure, you have more collagen, so it takes better and it lasts longer. Um, those are the very big changes that have taken place with the stem cell treatments.
Right. In the last few months, I've seen a lot of online celebrities who look tremendously younger, and they claim they haven't had plastic surgery. Is this what they're having? They're having these stem cell treatments in your practice?
A lot of the people who come to me are doing it because they want to be able to stay like somebody who's on camera. This is their face. This is their job. They can't change their face. So
Right.
they come to me because it doesn't change you. Uh, one of the one of the best things that happened in the last few years was that uh, a very famous model came to me saying, "I'm not getting the jobs." They told me, I have to do something. And so I came and I did the stem cell treatments for her. 6 months later, she was back on the cover of a magazine, and nobody could tell. She just looked like herself, just
Wow,
very natural.
that's awesome. Now, what about the STEM natural intelligence, which I mentioned earlier? Can you tell us what the ingredients are in that product line and what the benefits of those ingredients are?
Absolutely. Um, so not everybody can come to my office and have surgery, and not everybody needs surgery, right? So how do we utilize this fountain of youth, this huge, powerful language of stem cells without having to do surgery, is to use the language that we've been able to bottle into the regenerative serum and into the stem cell line that we've created. STEM Natural Intelligence actually stands for science, technology, mentoring, and education. So the whole idea of how we took these cells, how we mentored them, how we got that language is based on the sort of the pattern that we had to develop to bring the language of stem cells. And what's in it are basically exosomes, peptides, uh, factors that are regenerating, anti-inflammatory factors, and those vitamins and minerals that's in it really are giving the resources to the cells and to your body to regenerate and rejuvenate the skin so you can get it back into balance. And once the skin is in balance, now it can heal and look its best. And the reason this is a game changer is because it replaces like 5 or 10 other products. You don't need to have a hyaluronic acid and a vitamin C and a retinol and a different, brightener or all these things. All of that is within the language because all those things are happening because of the environmental damage causing imbalance in the skin, aging process by itself causing an imbalance in the skin, or your lifestyle, like if you smoke, if you drink, if you're, not sleeping well, all those things affect your skin. So if we're able to bring the resources and give back the directions, say, hey, we want you to renew and regenerate, then you'll see it very quickly.
Hmm. Now, are these products good for all skin types, including people with sensitive skin? Is it good for black patients and white patients and people who have sort of brownish color skin?
Absolutely. So stem cells are universal. They don't distinguish between uh, color or between different races or different ages. They are there to do a specific job. And the language that they give us is universal. So if I say the same thing to an old person or a young person, it means the same thing to both of them. And that's really what we're doing. If we're giving the cells the language that says, hey, I want you to stay young, healthy, and good, then everybody understands that and they do that. Um, aging process actually is because there's the rate of the stem cell replacing the cells that are dying down is not keeping up with the cells that are getting damaged and dying off. So we're aging. If we were to tip that back and we had stem cells, just like when I inject it, or if we give the signals and wake up the sort of cells within the body, then we're able to tip that balance a little bit and restore everything so we don't age so fast and we in fact can reverse it.
Right. So you're supplementing with new cells basically. Now,
Yeah.
let's say you have an 80-year-old whose skin is wrinkled and they want to look younger and get younger looking skin. Are the stem cells in an 80-year-old in good enough shape to create the effect that you want? Because the stem cells are 80 years old too. Or is a stem cell automatically always young?
So that's a great question, and we've had a lot of research done on this. In fact, I did a lot of research on this myself. The most amount of research that was done is on bone marrow because we were doing bone marrow transplant for 50 years before. So we have a lot of data. But when you're growing and your body's growing and your bones are growing, the bone marrow has a lot of stem cells in it that are making blood and bone and helping you grow.
Right.
Once we're done with that in our 20s, we don't need it. So the stem cells in that goes down. Traumatic, like 50% of it goes away. So we used to think that all of it went away everywhere, but that's not true. In fact, we studied the stem cells in different patients and in different parts of the body. And the stem cells actually are very well maintained within the fat throughout the ages. The oldest patient I've done is 85 years old.
Wow.
I did a stem cell lift on her at age 85, and she had amazing results. If you're healthy and you're good, you're good. We are alive because of those stem cells, and we need those stem cells to be healthy enough and robust enough to keep us alive and to renew us. So if we were able to do that within the clinic, we're able to also signal them with with the serums to get the skin to do the same thing. Because the skin, as you get older, you have a lot of that damage. But if the
Right.
sooner we start to counter all the environmental damage, all the causes that make us age, the sooner we start to sort of fight that damage and to put that at bay, the longer we will look younger. So if you're looking good, you will look better. If you're not looking good, you have to do more to get there. It just takes longer to get there.
Right. So it seems like the stem cells almost have this internal fountain of youth. They remain younger than the other aging cells in our body. And so if you can put them in an area where they do their job, they actually make you look younger.
Yes, absolutely. In fact, they did a study saying if you take an old cell and you put a young cell next to it, the old cell starts to become young. And I think the reason that old cell starts to become young is because the young cell is giving the signals for it. So if we're
Right.
giving the signals, then your cells are going to do the same thing.
Right. I've seen some reports that some older people are having blood transfusions from younger donors, and apparently it makes them feel better or healthier. That hasn't been studied sufficiently enough to make sure that works, but that's kind of a similar type of reasoning. If you have younger cells there, they're doing a better job. Now, does that imply that if you start these treatments at a younger age, it will be even better and you'll get better results and your skin aging will be decelerated instead of accelerated with time?
Absolutely, because you're going to turn the clock back so much. The more you keep it youthful, the more we can keep that balance of, things breaking down versus things being replaced. If if that balance is in check, you don't age. But if it's very imbalanced, you're going to age very quickly. If it's the other way, you're actually going to turn back the clock, right? So
Right.
if we can maintain the skin, if we can give it the nutrition, if we can keep it in balance, if we can fight the environmental causes that are causing inflammation, that are the inflammation that's caused by the environment and all the UV rays from the sun and the electronic devices that we use, all are sort of having a havoc on our skin. So the sooner we sort of help our skin and our bodies to stay healthy, the longer we were able to do that.
Right. It's kind of like exercise, I think, is an analogy. If you start exercising at a relatively younger age, it's been shown that it's beneficial to all your organs and it reduces all-cause morbidity and mortality. So this is sort of a similar thing, not exactly the same.
Exercise actually helps to maintain your stem cells. That's why.
Really
Yeah.
interesting. So stem cells like it if you exercise. That's great.
Yeah.
Now, I looked at your website and there are a lot of before and after photos there, and the after photos look really amazing. But what percentage of patients really get that great result that I saw on your website?
Majority of the patients actually do fantastic because it's their own cells, it takes and it does well. Some patients, if, like you said, if they got a lot of damage, if they are not as healthy, they may need more than one treatment to get to where they want to be. But majority of the patients see a tremendous improvement in their skin and in their quality of the tissues. Um, they look much younger and healthier just with one treatment. But beauty is in the eye of the beholder. So
Right.
most people who allow me to put their pictures and use their pictures in Beverly Hills is a little challenge because of the people who come to me.
Right.
But the people who do allow me to use it, these are normal people that got regular results.
Right. And they're happy with the results.
Yes.
That's great. Now, are there any risks to these stem cell products and procedures that you do?
So yes, so any procedure we do, there's risks to it.
Right.
The biggest risk of anything that we do in the skin, any time we put a needle into the skin, is if you're gonna get bleeding and bruising. Those are the number one things. Infection is the next thing that anytime you pierce the skin.
Right.
But in my 25 years of doing the stem cell lift, I've had 5 infections, and that's really, really rare to get an infection, and we just give them antibiotics and gets better. So it's a very uncommon thing to happen, but it's there. In the old days, the techniques were different, and we were using sharp instruments to inject, and the way we were injecting was very harsh. They used to have the risk of injecting into a blood vessel and causing, God forbid, a stroke or blindness or something, or uh, I've never seen that. I've never seen that in my 25 years with my techniques and with the ways we use the instruments because those instruments are blunt, they're not sharp, they are very, very safe to do. So those are the major risks. If you don't get an infection and you don't scar and you don't have those things, there's no major risk with it.
Right. And since it's your own cells, you can't have a rejection or
No.
extremely
There's
severe.
not no risk of the cells themselves turning into anything, or we've tested it for cancer and things like that. We've never seen it, and that's not 1 or 2 patients. It's not just me doing it. There's no reports of it anywhere in any of the literature in the world that's ever happened. The only time you can get those things is when you're using embryonic cells, which have ethical issues, which we don't control what happens, because that the job of that cell is to make a human being.
Right.
The job of the fat cell is to repair your tissues. So you got to use the right tool for the right job.
Right. Makes good sense. Now, people watching this, I'm sure there are many now who are interested in getting this treatment. Do you have a website where they can go to get more information about this?
Sure. NathanNewmanMD.com is my
Oh,
website.
okay.
NathanNewmanMD.com is you can see, the procedures. There's a link for the STEM Natural Intelligence products. You can link to that. Um, and the natural intelligence products are actually very clean, unlike other products where we had we have to worry about having animal products or other human products. Uh, where we can get transferring infections and things like that. Our products don't have any of that because it's plant-based. So we don't have to worry about it having ethical issues, having any issues with environment or any infectious agents. So it's really a game changer in the whole industry.
Oh, that's great. I mentioned earlier that you're an author now. Can you tell us about your new book, what it's about, how patients can benefit from it, and where they can purchase it to get more information?
Absolutely. The book is basically my journey through the stem cell world that I've gone through over the last 25 years, how I went from sort of discovering the whole stem cells in the fat to coming up with the products that we've sort of made through this technology that we've studied. And it's really to educate the lay public about the fact that stem cells are not something in the future. This is here today, now for you, and is not some experimental thing that we're doing. This is tried and true, 25 years worth of experience in my hands, and there's thousands of people in the world who are doing it, and we're sharing this knowledge and we're always growing our knowledge base and we're sharing this data. And I think the more people read about it, they'll see it. So they can see it's not just for cosmetic. I also use it for wound healing. I also use it for post-cancer reconstruction. I use it for autoimmune disease. I use it for joints and with amazing success. And I think people should know that this exists, they can use it, and they can benefit from it. They don't necessarily need to come to me for everything. There's fantastic doctors around the country. But if they want to look for alternative things besides what is available in the system, because these things are not available necessarily if you go to your hospital, if you go to your regular clinic, they're not available because the system hasn't adopted it yet. I think they will do it very soon. Things are coming around and things are changing. But that's the reason. The book is not out yet. It should be out very shortly. And I'll put it on my website and people
Oh,
can share it.
good.
And I'll
I'll post your website information, and people can go there when the book is out. They can find out how to get that. Now,
wonderful.
your practice is in Beverly Hills, so you probably have a line down the block of people who want this treatment. But what about people in other parts of the country, in Idaho, Nebraska, Maine, Texas, Florida? How do they get this treatment if they can't come to your office in Beverly Hills?
Well, that was one of the reasons we created the STEM Natural Intelligence line, so that people can actually benefit from the technology without having coming to me. So they can see improvement in their skin. Now, if I have patients flying from all over the world to
Hmm,
me, so
okay.
they're coming either for cosmetic or they're coming for autoimmune disease or for their joints. And, you know, we're happy to do a Zoom consult with them. Just give them the information. If there's the right thing for them, then they come out. We do the procedure for them, and they can go home and they'll recover very quickly from the treatment. I've had patients fly in, do the procedure, and fly out the next day. So there's not much downtime with it. Um,
Are there other dermatologists or cosmetic surgeons around the country that are using your technique or that you've trained?
so my technique I have not trained other doctors yet with my technique, but there's doctors who use different techniques. And one of the things we're trying to do is actually bring my technique and teaching it to other physicians. So that's one of the things I'm working on right now.
And if a patient in other parts of the country wants a good cosmetic dermatologist, what's a good source for them to go to find that?
There is a American Academy of Cosmetic Surgery. They can look at that for regular cosmetic surgeons. They can go to Cell Surgical Network. They are people who do a lot of cell surgery, what we call stem cell surgery. We call it cell surgery. Um, or they can, like I said, I'm happy to just have a Zoom with them and tell them if this
Right.
is something for them. And if there's somebody I know that I can refer them to if they don't want to come here, I'll be happy to do that.
That's great. Now, there was an article in the Wall Street Journal, I think it was about 9 months ago or so, about cosmetic dermatology and the fact that it's super popular amongst medical students these days. Why is that? And where do you think the specialty is headed in the next few years, especially with this stem cell treatments?
I think medicine is going through a revolution, and it's really changing how we perceive our health, how we perceive wellness. We're living longer and longer, and as we're living longer, you know, we want to also be able to live fuller. We don't want to have just the age without the quality. You want the quality of life. Just living in a bed somewhere, hooked up to tubes, that doesn't do a lot for any people anymore. So I think that's what's the driving force for all these changes. And I think stem cells are on the forefront of that change. And uh, the dermatologists in general are more adaptive to technology than other fields in medicine. Oculoplastics, ophthalmologists are also very adaptive. That we like to advance things. We're not so conservative in terms of how things are done. We're more likely to try to push the envelope. I think that's one of the reasons that these fields are sort of the cutting edge of technology in they've been and they'll continue to be.
And that's why a lot of medical students are interested in
Yeah,
going into these specialties.
I think so.
Right. Now, every doctor I interview, no matter what specialty, I now ask them about AI because AI is like the hottest topic after stem cells. How do you think AI is affecting dermatology and cosmetic surgery?
I think in a very positive way because AI is a fantastic tool.
Right.
It's a tool. The way we use it is important. How it's done, it has to be the right tool for the right thing, right? Um, just like stem cells have to be used properly, AI needs to be used properly. I think to use AI will shorten a lot of the path to getting diagnoses, to getting to screening so that people don't have to have testing done, being cut on without necessarily needing to do it. I think all those things are going to be streamlined. I use AI in my stem cell research, and it's amazing because the amount of data that we have to go sift through, it's would take me months to go through all the journals and all the things that we have to look
Right.
for. And here I put in AI, it goes and gives me a lot of information. Not all of it is accurate. You have to sift through it,
Right.
but instead of doing a 6 month search, and I do a 3 day search and I'm done. And it's a
Wow.
big difference. And I think people just need to know everything that we use is a tool. Your phone is a tool, your car is a tool. You just gotta know how to use it. AI is one of those things. Stem cell is one of those things.
Right. Interesting. Well, this has been very informative for me, and I'm sure the people watching this as well will gain a lot from it. And I'll post your website so they can get more detailed information about this. So want to thank you again for taking time from your busy day to join us on the Doctor Podcast program to tell us about all these incredible new changes that are happening. I appreciate it.
Thank you very much for having me. It's been a pleasure.
Thanks.